Okay, so briefly going to go through the respiratory system, the parts air flows through for you to be able to breathe. It's best to breathe through your nose, because if you breathe through your nose, then it goes through your sinus cavities where it gets cleaned, it gets warmed, it gets moisture added for better diffusion of oxygen. So it goes down into the common area we call the pharynx. You have the nasopharynx and the oral. You guys just have to know pharynx. Goes through the pharynx, and then it will go into this part here behind this shield cartilage. This is thyroid cartilage. It's protecting the larynx, the voice box. At the top of the voice box is an epiglottis, a flap, that closes when you swallow food, so food will be pushed down the esophagus, which is posterior to the larynx into the trachea. So there is your larynx. You can see here wrapped around here the thyroid gland. And then here's your trachea. The trachea is a short tube that goes down. Because you have two lungs, it has to split into two primary bronchi going in each lung. On the left, you'll see this primary bronchi branch into two secondary bronchi, which are also called lobar bronchi, because they're going into each lobe of the lung. Your left lung has 2 lobes, your right lung has 3. So you should be able to see 3 branches here. 1, 2, 3. The lobar branches then into smaller branches called tertiary bronchi or segmental bronchi. Each of your lungs, like the one on the left, has about 8 segments. The one on your right has 10. Left has a little left because the heart is more toward the left here. Then after the tertiary bronchi, they go into smaller, what we call bronchial tubes, which eventually will go into the alveoli, the air sacs of the lungs. Those are little sacs designed totally to diffuse oxygen in and out. They are lined with simple squamous epithelial to allow for quick diffusion of oxygen and carbon dioxide. Here's your diaphragm, helps you breathe. When you breathe in, the diaphragm flattens, it goes down, and the ribs expand to make that chest cavity bigger, to have less pressure in it, more volume, less pressure, so air will shoot in. When you're breathing out, the diaphragm relaxes, it goes back up into that dome, the ribs move down and in, making a smaller cavity, more pressure, pushing the air out. You don't even have to think about breathing. You breathe about average of 12 to 15 breaths per minute under normal circumstances. Your lungs are like sponges. This is lung tissue here. It's like a sponge. You can squish it. Lungs go down further than you think, but they go down to your diaphragm. Looks smaller here in this model. But that's really the gist of your respiratory system.